There's a passion that is involved in taking care of oncology patients. You have to love what you're doing in order to be good at it. And I think people that, nurses that like to take care of oncology patients, it just shows in how they talk about it.
My staff, my nurses, the nurses that we work with, I have a lot of respect for them because they really truly care and love their job. It's not that they come in and that's what they do is just because it's a way to earn a living. No, because they deeply believe in what they do.
People ask me that, how do you work on oncology? Isn't it depressing? And I tell them, they're the most full of life people you'll ever meet. You truly don't know what life is about until you're faced with the fact that something could happen to it. And those people cherish the things that are important, ignore the mundane, and live life to the fullest. And as a nurse helping care for them, that makes me see those things more clearly in my own personal life.
Many people say, why do you go into oncology? It's such a bummer. It's such a downer. We don't see that. We see that we're making people better. And if you walk into our office on any given day, you will hear people laughing, joking. In fact, there's many times when we have to say, hold it down a little bit.
They're in a very vulnerable position when you meet them in this particular diagnosis. And I think that tends to leave them more open to you. They share a lot more. They trust you, very quickly, and I take that trust very seriously and try to do the best job I can for them.
And it's really rewarding to see people come back as survivors 5 years after their diagnosis, 10 years, 15 years. I mean, that's just absolutely, it's a joy. I mean, I'm privileged to be able to participate in those people's lives and see that they've been able to have a great life and they're doing wonderful and coming back year after year. I mean, that's really a privilege for me to be able to do that.
The thing that makes me the happiest about my job is the patients and making patients feel better and getting them through something that I have personally been through. And I just think that if I can help somebody get through it a little bit better than what I got through it, that's what I'm here for.
It's the patients. I mean, I had a personal history of breast cancer, so the ladies that are here with breast cancer, it's amazing the strength they have, because I thought it was awful, to be honest. But they have such strength and hope and faith, and it's just a good thing to see every day.
We have a great group of patients that, keep you wanting to come back, put a smile on your face. They might be having the world turn upside down on them, but you won't ever see that on their faces. I mean, they keep you going. You think you have a bad day, and then you think about, well, they're going through a lot more than I am, and they're really happy, so what am I complaining about? So it's nice to see them smile and joke around with you. It just helps them get through the whole process, especially when work can be work. There's good days and bad days, but coming here and seeing them makes every day a good day.
The staff is amazing. Again, first coming here, they were, nurses and staff, and the more I came here, the more they were friends and they've all become family. They ask about my kids and my husband and how things are going, and not just health-wise. They know everything about my life and what I'm doing and what my kids are doing. So they're amazing. They're family.
It's hard to put into words, but from the day I walked through the door, they were fighting for me. I felt they had my back. I felt good about that. And I do trust each and every one of them, and to this day. I mean, I still do, and I wouldn't go anywhere else.
But I suspect these guys fight with you right to the bitter end of whatever, And I think they've done it a lot.
They were very supportive, every one of them. I've never met them before, but yet by the time I was there that one day or 2 days and got to meet most of them, they were just like people I've known all my life. They're unbelievable. If I wore a hat, I'd take my hat off to them, but I'm just telling you, that's the way I feel. I just thank God that there are people like that can do that and give you that support.
They must have large guts, you know, because it would be really hard. And you have to be some kind of, I don't know, you gotta be awful compassionate, and I couldn't do it. Because they see us at our best and, you know, at not so good. And keep doing it every day, wow.
When you lose your hair, that's really tough, and they were really good about that. They were always so complimentary. Every time I came in, you look really great, you know, and they just were very helpful. They understood exactly what I was going through and made me feel good about it as best they could.
They have so many qualities because you have so many different people that you work with. I think the caring part is the most important thing because they do care about you as an individual. They care for you. You know, if you need somebody's shoulder to cry on, they're there for you.
I thank them from the bottom of my heart. There's no other way to say it.